America keeps telling people the answer to expensive healthcare is government-run universal healthcare. But that is where the misdirection begins. The problem is not that healthcare is private. The problem is that competition has been corrupted. While government and powerful corporations have been allowed to work together, instead of keeping each other in check. The solution is not to place payment, coverage, access, and final authority beneath one government-controlled system. The solution is a privatized healthcare market, with government enforcing the rules instead of becoming the market. Capitalism works through competition. When insurance companies and healthcare providers must earn customers, they have to control prices, improve quality, and keep innovating. If a company becomes dangerous, dishonest, outdated, or too expensive, people should be able to leave it. It should face liability when it harms patients, lose business when it fails them, and eventually disappear if something better replaces it. That is where survival of the fittest belongs, among businesses competing to serve people, not among sick people competing to survive. But honest competition does not mean the largest company must automatically be destroyed. A monopoly that grows because it consistently provides the best price, quality, reliability, and innovation is not necessarily evil. It may become part of the economic foundation other industries build upon. When that happens, its checks and balances change. The law still governs it. Safety and quality standards still bind it. Fraud and negligence still carry consequences. And the businesses, workers, patients, and industries built upon that foundation place new demands upon it. When done rightly, a dominant company can raise the standard of life, while giving new industries and innovations a stable foundation to grow from. But if it raises prices too high, stops improving, or fails the people depending upon it, it creates the opening for competition to rise again. Market dominance should be earned and remain vulnerable to something better. The corruption begins when a company no longer has to earn its position. When it buys protection through lobbying, bribery, special laws, or regulations written to keep competitors out. That is not capitalism. That is power protecting itself. And a government healthcare monopoly is even more dangerous, because the institution writing the rules also controls the money, the access, the coverage, and the final decision over care. A referee who owns the field, controls the scoreboard, and decides who may play, is no longer a referee. Government has a necessary role. It should enforce safety, honest contracts, clear standards, legal accountability, and consequences when patients are harmed. It should restrain corruption. It should not become the single gatekeeper through which everyone must receive health care. The answer is proper capitalism, private health care, real competition, earned success, lawful restraint, and no protection for institutions that fail the people they exist to serve. Protect the patient. Hold the industry to the law. Let excellence become the standard. Let innovation grow from that foundation. And when something better rises, let it compete. Healthcare needs checks and balances, not all power gathered into one pair of hands.